So we would start with an observation, like any good osteopathic assessment. You'd start with an observation. So we'd have especially a look at sort of the middle of the trunk. It's always good to observe sort of the gap between the arms and the waistline to see if the shape is the same. We can have a look at her muscles. We can have a look at the belly button if that's sort of central. It's got a little bit of a tendency to pull over there. And then I would get her to do a few movements. So if you could just raise your arms in front of you, over your head, and we would want to observe this area, how that opens. And we're just going to, if you drop your arms back down again.
So how would it look if it were wrong?
So it could be that this doesn't open it on one side or the other as easily as on the other side. And then you would pay a special attention to that in the palpation if there are any densification. So if you just slowly do that again, that you lift your arms over your head. And we just see how the pectoralis will open and if it can do that well. And if you bring your arms back down again, and then we do that from the side. So if you just go into abduction, lift all the way up. And we can see that that was hanging a bit.
Yes, yes.
While she was lifting this. Yeah, so it'd be interesting to see if the fascia there is restricting this. And bring your arms back down again. Lovely. And then you turn around and we have a look at your back. So again, we would observe sort of symmetry of sort of skin folds. We would observe the symmetry of the curve of the waist and the gap between the arms and the waist. We'd have a look at the levels of the iliac crests. And then I would get her to do those movements again. So if you just lift your arms up and bring them back down again and lift them up to the side, all the way over your head and bring them back down again. And there's some restriction here. So that's not gliding as easily. So I'd be more interested in that. When I come to palpation. Now, if you step back just a little bit, so I can get you to put your chin to your chest and bend forwards. So I'm observing, especially in the lumbar spine, if there's any area that can't open that well. If you could just slowly come back up again. Good. And then I would stand behind her and watch from there, but I'll just get you to do those movements. So if you lift up, we just get the audience to see that. If you just, no, stay there, but lift up one knee all the way, and we observe how stable she is. And I know she's not that stable on that foot, so I just stayed close to her. But what we want to observe for really is when she lifts the leg, how the glutes stabilize her, and if she can recruit all the glutes well and fast. And so one part of balance, for example, could be if you've got a problem in the thoracolumbar fascia and densifications there, that the patient can't recruit the glutes fast enough to stabilize. Okay,
so this is effectively, it's a Trendelenburg.
Well, but it's more in a Trendelenburg, if I don't get that wrong, it's sort of you are actually looking for actual drop.
Yes.
But this is more, I'm also looking for quality of motion, and is she wobbling while she's doing it? So it's not only a positive test if she's dropping.
Yeah, and I think where I was going with that is that a lot of these things everybody would have done before, but you're actually introducing here an aspect of examination that might be a little bit, might be taking a little bit further.
So see, I must admit, I feel often when we teach or we have taught or we have been taught observation and movements, we don't actually get told what to look for. And so I'm trying, we just say, well, look at them and it's a back. And I'm trying to be specific about what I'm actually fascially looking for. So if I get you to lift the other foot, and she's got more stability on that side.